Right now on ABC 10 News at 4 o'clock, an FDA committee votes on whether to recommend COVID booster shots, who the panel says should be able to get a third dose. Plus, the suspected Poway Synagogue shooter in federal court today, the latest on his plea and what it means for his future. And the U.S. military admits a drone attack in Kabul killed innocent civilians. What the Pentagon wants to do for the family of the victims.
ABC 10 News at 4 starts now.
An FDA committee recommends booster shots for some Americans while saying it's not necessary for the entire population. Thank you for joining us. I'm Kimberly Hunt. Camilla Bernal explains why the decision was made by the panel and who's now eligible for a third shot.
3 COVID shots, now the recommendation for some Americans who've had the Pfizer COVID-19 vaccine.
Dr. Lee, yes. Dr. McKinnis, yes.
Vaccine advisors to the FDA voting Friday to approve a Pfizer booster shot for people 65 and older.
We do have a unanimous 18 out of 18 who voted yes.
The yes vote coming after hours of debate and presentations, and after a no vote for Americans 16 and older.
And we strongly encourage all the different viewpoints to be voiced and discussed regarding the data.
Experts at the CDC highlighting how the Delta variant affects the rate of breakthrough infections, and researchers from the UK and Israel presenting data about how giving boosters could lower the rate of breakthrough infections.
We're seeing a robust immune response that equals or greatly exceeds the response that we've seen after the second dose.
Pfizer and other researchers say their studies show people develop strong immunity after 2 doses of the vaccine, but that levels of antibodies start to drop after a few months. However, some experts are pushing back.
It's not clear to me that the data we're seeing right now is applicable and necessary general population.
I'm Camila Bernal reporting.
Coming up at 4:30, we speak to a local doctor who is on that FDA panel and voted today. We will get his words on what happened today. The CDC announced that it's spending more than $2 billion to improve infection prevention across healthcare settings. The funding is aimed at preventing the transmission of disease inside hospitals, dialysis centers, and other facilities. The money is coming from the latest COVID relief package. Of the new funding, $500 million will create and train strike teams to help facilities with known or suspected COVID outbreaks, and nearly $900 million will spend over the next coming years to support research and training on new ways to control the spread of infections. Parents pleading after their 8-year-old son got multi-system inflammatory syndrome, a rare and serious condition associated with COVID-19. Our Sofia Hernandez shares this family story and what the hospital says you can do to prevent this from happening.
When I see on my son, it was something scary for me.
Leo and Rosa Cortez wishing they could go back in time. Rosa got her first Pfizer dose August 2nd. 8 days later, got COVID, then her husband.
Now we understand now that this is a wrong decision that we took.
Their 8-year-old son Eduardo feeling congested, but mostly asymptomatic. That is until this past Saturday, when he had an 106.1 fever, rashes, and swollen eyes.
It's really hard. It's something that I can't explain, because at the moment when you live that moment, your reaction it's just all that you want is just give something to your son that he can wake up and just go home.
Rady Hospital says to date they have seen 80 cases just like this one, no fatalities. And it all starts the same. Unvaccinated individual gets COVID-19. Roughly 2 to 6 weeks later, children between the ages of 8 to 16 show symptoms.
So kids are coming in with fever, rash, some red eyes, some neck pain and swelling of the neck. They get severe abdominal pain as well.
Dr. Tremolay says this post-inflammatory disease resulted from COVID-19, with roughly 4,000 cases nationwide, with a mortality rate of roughly 5%, which could all be avoided with a simple dose.
The key part to the story was that his parents had had COVID about a month before.
Hesitancy that his parents had in getting vaccinated. Now they are by their son's side, watching him push through to see another day. praying others never have to be in their shoes.
It's to do it now. It's now. We don't have to wait another day. We don't have to wait to see my case and see our child in the hospital, because it is really hard, really hard.
Sofia Hernandez, ABC 10 News.
Eduardo has been receiving around-the-clock care for the past 5 days. His parents think Monday he may be able to return home.
Demand for monoclonal antibodies to treat COVID-19 has been increasing. That has the Department of Health and Human Services worried about supply. The federal government announced a contract with Regeneron this week for 1.4 million additional doses of the company's antibody treatment. But HHS also changed its policy this week around the treatment and is temporarily setting rules for distribution of it. Until now, medical facilities and doctors have been able to order it directly. Now HHS will determine the amount that each state receives on a weekly basis. Monoclonal antibodies are one of only a few FDA-approved treatments currently available for COVID-19. All of them require that you go to a care facility to receive the treatment. A new drug to treat COVID-19 that is going through clinical trials now would change that.
This gives us an option for outpatient therapy that could be distributed from a doctor's office, from local pharmacies, even over the phone if it's available. So frankly, it could be a very effective therapy and much easier to get, much easier to use for the general public.
Dr. Jim Harris is part of the trial for this drug at the South Bend Clinic in Indiana. It's one of a number of healthcare systems participating. Patients diagnosed with COVID who are not at risk of severe illness are being given a pill that Pfizer developed. They're getting it in addition to another drug used in combination treatments for HIV. Now, Dr. Harris says the two drugs by themselves may not be that effective, but together they work to stop the reproduction of the COVID-19 virus.
My greatest hope is that everybody gets vaccinated and that reduces the need for drugs like this. But going forward, if we have a readily accessible option like the COVID pill we're talking about, I think that would dramatically reduce the spread of the virus and stop it earlier in its tracks before it really gets to the point where it's causing serious disease and leading to hospitalization or even death.
Dr. Harris says that early trials have shown that this new treatment is effective and safe, but now they'll need to see if that's the case among a larger number of patients. Patients have had minor side effects, including a headache or a stomach ache. Now, if the trials go well, he is hopeful that the therapy could be available by early next year. A growing number of women are turning to online learning during the pandemic. The impact that this could have on the job market recovery and in closing the gender pay gap.
New today, the man charged with carrying out a shooting in a Poway synagogue in 2019, which killed one woman and injured 3 others, has pleaded guilty to more than 100 federal charges. ABC 10 News reporter Mimi Alcala is live downtown at the federal courthouse. And Mimi, this comes as he is awaiting sentencing on state charges later this month. Unfortunately, we're having audio issues with Mimi Alcala. As soon as we fix those, we'll get back to her at the courthouse here in San Diego. Meantime, there are security concerns over tomorrow's planned rally in Washington in support of people charged in the January 6th riot. Fencing is already up along the Capitol with law enforcement on standby. Those behind the rally say the event will be peaceful and nobody will be bringing a weapon, but Capitol Police are not taking chances.
There have been some threats of violence associated with the events for tomorrow, and we have a strong plan in place to ensure that it remains peaceful and that if violence does occur, that we can stop it as quickly as possible.
More than 700 people are expected to attend. The U.S. military says a drone strike in Kabul days before its military pullout killed 10 innocent people. And that August 29th strike was intended to target members of ISIS-K in retaliation for a suicide bombing that left U.S. service members dead. But today, the top general of U.S. Central Command said an aid worker and 9 others, including 7 children, were killed instead.
Moreover, we now assess that it is unlikely that the vehicle and those who died were associated with ISIS-K or were a direct threat to U.S. forces.
The The Pentagon is considering making reparation payments to the families of those victims.